All right, next, let's queer up health. CDC study reveals what we didn't know about HIV behaviors and the barriers to care. The CDC's Medical Monitoring Project provides crucial insights into the care and challenges faced by people with HIV in the U.S., based on the data from 23 areas, including Florida. The findings show that 80% of adults with diagnosed HIV did not miss a medical appointment in the past year, and 95% are on antiretroviral therapy, with 62% adhering to all prescribed doses. This reflects strong engagement in care and the effectiveness to the current HIV management strategies. However, barriers like stigma, discrimination, and socioeconomic challenges continue to impede access to care, particularly within the Florida's LGBTQ+ community. These challenges often prevent LGBTQ+ individuals from seeking timely medical care. The MMP data emphasizes the need for targeted interventions to create more inclusive healthcare environments, reduce stigma, and improve health outcomes. The report also highlights that over 50% of people with HIV in the U.S. are now over the age of 50, raising concerns about their future healthcare needs as they transition into Medicare. People with HIV often face more health challenges on Medicare than those with private insurance. Additionally, 27% of HIV-positive individuals have unmet mental health needs, and 19% experience food insecurity, indicating significant gaps in support services. Addressing these gaps is crucial to improving the quality of life for people living with HIV and ensuring they receive comprehensive care tailored to their needs. Well, I just came back from the Ryan White conference last week in DC, which was very interesting because a lot of the topics were dealing with aging, especially those people living with HIV and what that represents, and the Medicare issue came up. A lot of issues came up about medical case management, having case managers to help people as they're aging get through these issues, especially with Medicare. I was kind of like gut-wrenched when they were talking in classes about geriatric HIV care, and I'm like, what age group do you consider geriatric? And they're like 50 plus. And I'm like, oh, yeah, okay, wait a minute. Let me rethink this. But we do in Florida, while the numbers overall nationally speak great, we do have our barriers here in Florida itself, specifically with LGBTQ individuals. We have problems with mental therapy not being utilized. In the Ryan White system, we have 8,000 people in Broward County alone that use Ryan White services. And I would say less than 200 people actually use mental therapy services. Wow. Which is unbelievable. So the services aren't being utilized, but they're also not being, I would say, advertised to individuals properly to get the education and the knowledge to help them navigate systems. I do think, obviously, with antiretrovirals being injectables, that's going to be a game changer as they continue to move that forward to be a longer time, because right now it's every 2 months, but I could see eventually it's going to be longer, and that's going to be a game changer in our community overall. Right.
I was going to ask you, because I was talking to a friend over the weekend, and we were talking about, he comes from a conservative state, comes from South Carolina. Again, a lot of the HIV transmission there is amongst men who are not out or on the DL. And we were talking about the initiatives and how the outreach goes to, a lot of our outreach for HIV goes to our LGBTQ community. Right. However, if you're in the closet or DL, you're probably not going to go get on PrEP when you have to bring a prescription home where you live with your wife, and or live with your family, or you're not going to seek those care. Right. What type of what things is happening in the HIV world that's actually getting to that audience? Because I feel like those transmissions are coming into our community because our community's having sex with those people who are not identifying.
Exactly. Well, and you talk about PrEP, which is a great thing. And obviously, there's the pill that you could take every single day. But now with injectables, they have, one that's out, you get injectable every 2 months. So you go to the doctor's office, you're not taking a prescription home. And we see that in our youth too. They don't want their families to know. Yeah. So they hide medication. Or I remember one story of a girl hiding her HIV drugs in her spare tire in her car. Oh, I can. Because she could not. Yeah. But then you also hear the stories of the mothers who sell their drugs so they could get food for the table for their children. So, there's a lot of things out there, and it's a way of how do we get that access for free, which that kind of still is happening. Insurance does, cover it, but it doesn't cover it 100% sometimes.
I also have to say this too, the stigma. You would think, like, we're so many years in, the medications are so good, people are living like it's a chronic disease now for the most part. You would think that the stigma would have, like, lessened, but it's still there. Like, yeah, exactly. You would have. And I think one of the things is people need to know more about you equals you.
Yeah.
Because when, you know, that whole thing of, like, if you're on your meds and you're undetectable, you're untransmittable.
Right.
Sometimes being with an HIV person is safe. HIV positive person could be safer than being with someone that's not, or that you don't know their status. Yeah, exactly. And I think that has a lot to do with it. I get, like, being scared of the stigma and not wanting to tell family, and, you know, that whole thing. It's still there.
Yeah,
it is still there.
We did a story, I want to say it was 3 or 4 weeks ago, on lenacapavir and for PrEP, and that is twice a year. An injectable that they've done pilot studies on, and they started it on women first, which was amazing that they did that. But it's an injectable twice a year. Can you imagine?
Wow, that's amazing.
Right.
Yep. Looking at the data and the CDC's response, because, like, my day job, I'm a director of research, so I tend to pull these big government data sets like this one. So I'm looking at it, and, you know, the things I found most interesting is, one, like most big government data, it's a couple years back, so this is 2021 that the surveys were from, and looking at what they compared from 2018 to 2021 of what changed. So, like, access to healthcare got a little harder, whereas people had less home insecurity and better food security. But I looked at it and I'm like, well, of course, like, in 2021, we still had an eviction moratorium, and the SNAP or food benefit program was more generous at that time, and hospitals were overwhelmed. And, like, a lot of researchers were all, like, I talked to different groups, the data between 2020 and 2023 is just driving us crazy because it's hard to say what's happening now based on that. But, like, I look at it and it's a reminder of, like, you know, when you do a program that helps many people, you end up actually helping a lot of marginalized people, HIV positive people, people with healthcare access. And so there's a lot more there that I hope that the CDC will, like, look at and really, like, go a little bit farther. But they probably won't. It's probably, like, research group.
And there's some issues with, like, the food programs currently, like the funding. And
food banks are running out of
food. Food banks are running out of funding, like getting the funding so that they can give out the food.
Well, you know, I was going to say that about Sunshine Cathedral, to be fair. They have 3 really, really incredible food insecurity relief programs. You know, I can't speak to the extreme specifics of it all. I think one is perished cans. One is, you know, they have the brown paper bags grab and go every day, all day. And they just said in last Sunday service that they're getting a refrigerated box for grab and go as well. So I know we're a small little city here, and we're in Fort Lauderdale, but if you are in need of food, it's no questions asked. You just come, you grab it, and we're grateful that you were able to do it. So please come, Sunshine Cathedral.
900 people every Wednesday.
Wow.
It's they were talking about how they started. I go to Sunshine Cathedral Sunday service, and they started at 10:30 a.m.
Sorry.
And they started, I can't do the 9, 10:30 a.m. They started with feeding 7 bags. They started 7 bags, and they mentioned 900.
900.
Amazing.
There's a lot of people dealing with food insecurity. People that you wouldn't even know. You wouldn't even realize.